Okay, so to continue with our liver imaging presentations, Dr. Aya Abdulwahab will present us a short talk about the radiological features of liver cirrhosis, which is should be very interesting. Liver cirrhosis and its radiological feature, how it appears on different imaging modalities. Liver cirrhosis is an end stage of chronic liver disease. It is an end stage of chronic liver disease characterized by replacement of the liver parenchyma by the fibrosis and regenerative nodule. Unfortunately, it is the 14th most common cause of death, and the main risk. It's the main risk factor for hepatocellular carcinoma. We have many etiologies for liver cirrhosis, as they are different according to different areas in the world. For example, in underdeveloped countries, alcohol is the most common cause of the liver cirrhosis. And other causes, viral hepatitis, hepatitis C virus or B virus, cryptogenic as non-alcoholic steatohepatitis, biliary disease as primary sclerosing cholangitis, primary biliary cholangitis, metabolic disorders, autoimmune hepatitis, vascular disease as body Chiari syndromes and other vascular abnormalities, cystic fibrosis. Also, you have other causes which is common. For example, after chronic use of methotrexate, the liver will develop liver cirrhosis. And the role of imaging of cirrhosis. What's our role in diagnosing the liver cirrhosis? We have a great role for diagnosing liver cirrhosis as for diagnosing the hepatic fibrosis, cirrhosis, and sign of portal hypertension. Also, we have a role in diagnosis and surveillance of hepatocellular carcinoma. We have different ways to diagnose liver cirrhosis. For example, radiology, as ultrasonography, CT scan, MRI, and high-resolution MR elastography, which is a new technique. And also, other than radiological technique, we have laboratory and biopsy. Now we will talk about biopsy briefly. Biopsy, it is still the gold standard for diagnostic of the liver fibrosis and cirrhosis, but it have many limitations. For example, it is costly, it's causing many complications as bleeding, and it's not suitable for screening. So our role in imaging, it will appear here. It's imaging is better for diagnosis of the liver cirrhosis. Imaging manifestations of cirrhosis. We have many manifestations for liver cirrhosis. Here, some of them. Surface nodularity is the most, it's most common, important manifestations. Normally, the surface of the liver should be smooth. But in liver cirrhosis, this surface will become nodular, and volume redistribution means that the size of the liver will change. For example, hypertrophy of the left lobe and caudate lobe, and atrophy of the right lobe. At first, the liver size, it is normal at first stage of cirrhosis, but then it becomes enlarged, and eventually the size will shrink, become small size. Also, the parenchyma, the aqueous texture of the liver will change, become coarse, not smooth. Believe me, in a lot of times, the first one to diagnose the cirrhosis is the ultrasonographer. Okay? If ultrasound is operator dependent. Okay? So if you have good eye, good experience, you can get the liver cirrhosis in a very early stage. Just one simple trick. Keep it in mind. The surface of the liver should be very smooth, extremely smooth, straight line. If there is any irregularity, nodularity, not like shrunken, just any surface irregularity, report it as cirrhosis. At least early cirrhotic process. Okay, let us see how it appears on different imaging modality. For example, this is ultrasonography for the patient with liver cirrhosis. Here showing that there is not inhomogeneous liver parenchyma and surface nodularity. Yes, cortical texture and surface nodularity here. The other one here showing that there is this portal vein dilatation, which happens in liver cirrhosis. There we have portal vein dilatation as a complication of the liver cirrhosis. The normal diameter is 13 millimeter, but here it is 14 millimeter. And here, this is the spleen showing the splenomegaly. Also, this is a Doppler showing recanalization as a complication of liver cirrhosis. This is another ultrasound for another patient suffering from hepatitis C virus with liver cirrhosis, showing that fatty infiltration of the liver, fatty liver. Also, the B, yes, it is fatty, and the B. This is there's massive collateral formation, upper and dilatation of the portal vein. Mm-hmm. Also, C showing the gastrosplenic collateral formations and umbilical artery recanalization. Also, the other one is this subhepatic.
They should put Doppler here to make these appear as vessels, you know. Anyway,
it was like that. Okay. What about CT? On CT also we have many changes. This is the CT for the patient with the, I think it was alcohol. No. Okay. This is the liver showing, liver cirrhosis showing enlargement of the left liver lobe and atrophy of the right lobe. And the other one, it is caudate to right lobe ratio. We will talk about it later. This increase, the ratio increases. Also here the vein is compressed by the effect of the course of the fibrosed liver. The diameter of the vein decreased.
Which vein?
Hepatic vein. Mm-hmm. And here recanalization of the umbilical vessels. That's why we don't have splenomegaly here, because we have recanalization of the umbilical veins.
Right.
Okay, and this is another CT for another patient showing also recanalization of the umbilical artery, gastrosplenic vein collaterals, surface nodularity.
What is the name of the non-recanalized umbilical vein?
Ligamentum teres.
Yes. Ligamentum teres recanalization. Okay. Which is the umbilical vein? It's the same thing.
On MRI, we can see there's also surface nodularity, caudate lobe enlargement, splenomegaly.
And the size.
Yes. Also, this is after gadolinium enhancement. We have also surface nodularity, hypovascular, regenerative nodules. Yes, splenomegaly and ascites. Now, what's caudate to right lobe ratio? It is a very specific sign for diagnosing of the liver cirrhosis on CT scan. We can come up by tracing a couple of lines through the axial section of the CT scan. One of the lines should be at the medial border of the caudate lobe, the other at the bifurcation of the portal vein to the right portal branch, and the third one at the lateral border of the liver. And we measure this distance. If the ratio become more than 0.7 to 1, it's very 99% specific for liver cirrhosis. Imaging manifestations. This image, you have many imaging manifestations, many signs for liver cirrhosis. These signs have a high specificity but low sensitivity. Why this? Because we may have patients having liver cirrhosis without any visible changes in their liver. For example, if we have these signs in patient, it indicates that they are very specific for liver cirrhosis. But if we don't have them, it doesn't mean that you don't have liver cirrhosis. So their sensitivity, it is low.
So these signs have low sensitivity, relatively high specificity.
Yes.
So if you see them, this is cirrhosis. If you don't see them, it might still be cirrhosis. And these include the surface nodularity, which have 95% specific, fissural widening, the fissures are wide,
Yes.
98, and the right hepatic notch.
Yes, I will
This thing.
explain. We have another late manifestations for liver cirrhosis. These are periportal space widening, expanding gallbladder fossa, posterior right liver surface notching. Next slide. Here, it's expanding of the periportal area, posterior hepatic notch, and gallbladder fossa widening. These are late manifestations. Here also, this is posterior hepatic notch, and this is widening of the gallbladder fossa.
Nice.
So elastography. What is elastography? It's a new technique added to the as this last decades added to the imaging. It is non-invasive technique to image the stiffness, elasticity of the tissue, measuring the transformation of the tissue in response to the stimulus, external stimulus. Elastography. It is. We have many ways to do elastography, but we have here a diagram showing that whenever the stiffness of the tissue, of any tissue, here we have liver tissue, whenever the fibrosis increase, the stiffness of the organ also increase. So by measuring the stiffness of that organ, we will end up by knowing the degree of the fibrosis in that organ. And the aim of the elastography is for that to know the level of the fibrosis non-invasively, which invasively we can know it by biopsy. Imaging invasive, yeah, okay. Elastography, we can do it by two ways, ultrasound or by MRI. By ultrasound, we have the shear wave elastography. Shear waves are, they are the most widely used technique. Ultrasonography-based technique, shear waves, they are after applying a stimulus to that organ, there will be formation of the waves, which are shear waves. The elastography is done by measuring the speed of propagation of these waves across the tissue. So whenever the elasticity of the tissue increase, the speed, whenever the stiffness increase, the speed of the wave propagation will also increase. This is imaging for different patients in different stages of fibrosis. The upper row is a grayscale imaging of the patient with liver cirrhosis of different stages, but they look same. They have minimal changes, not as much as to be seen grossly. But the lower row, this is after applying elastogram. This indicator should be put at the area of the interest for measuring the elasticity of that organ. Here showing that the color of these elastograms changes from blue to yellow to red, to yellow to green, and then to red. So by elastogram, we know that these different patients have different stages of fibrosis. They are at different stage. Yes, also we have MRI elastography. This also patients at different stage of fibrosis. By MRI elastography, we know that they are, according to the changing the stage of the fibrosis, the color-coded image are changed. For example, here it's a good liver. First, at the primary stage of fibrosis, it's blue, and the last one, it is at advanced stage of fibrosis, it is red color. So, as it is a good liver, blue color, and the red color, it's a bad liver. Okay, let me ask you if you know which of these images are at advanced stage of fibrosis. Which one? This is after applying the elastography. showed that the second one was at advanced stage of liver cirrhosis, and the first one the first stage. About complication of liver cirrhosis. Liver cirrhosis have many complications as liver failure, ascites, portal hypertension, hepatocellular carcinoma.
What do I do? Okay,
Portal
sorry.
hypertension. Portal hypertension is one of the complications of the liver cirrhosis. How it's formed? It's formed as a hepatic resistance increase due to fibrosis. The portal venous pressure will also increase, and eventually the portal flow decrease or it become reversed. For example, the blood, portal blood, it is toward the liver. But when it's reversed, it goes away from the liver in cirrhosis. Instead of being toward the liver called hepatopedal, and away from the liver it's called hepatofugal. So it becomes reverse, away from the liver. Portal hypertension. This is we have some changes that occur. Some signs of portal hypertension as ascites, dilated portal vein, splenic vein, superior mesenteric vein, collateral formation, splenomegaly, and various Doppler panel. Here, these are signs showing signs of portal hypertension. These are CTs showing here pleural effusions, ascites. We have ascites, paraesophageal varices, and splenomegaly. These are signs of portal hypertension. This also here, as we talked about it, the recanalization of the paraumbilical veins. And esophageal varices is a collateral formation due to portal hypertension. Gastric varices also.
You can see these vessels in the stomach and here.
Yes.
These are gastric varices.
No, there's nodularity also.
Yeah, cirrhotic liver, of course.
Yes.
So,
Splenomegaly. Here it's we have splenomegaly. Okay, ascites. Some ascites here. Okay.
maybe here. Yeah.
The last one is about the complication of the liver cirrhosis, which is a common complication, hepatocellular carcinoma. This is a patient suffering from hepatitis B virus. This is an MRI of patient. The first one is native MRI, T1, without contrast. The second one it is arterial phase, late arterial phase image. This is portal phase, and this is the equilibrium phase. The lesion shows enhancement in the late arterial phase. Late.
The arterial phase?
Yes. And showing washout, as Dr. said, at the late phase in venous phase. Please. Okay, thank you.